Hello and welcome. Today we'll be discussing a serious eye condition, central retinal vein occlusion, or CRVO, and its association with glaucoma. This is a condition that can significantly impact vision, and understanding it is crucial for both patients and healthcare professionals. We'll explore the causes, symptoms, diagnosis, and treatment options available. So, what causes central retinal vein occlusion? Think of the central retinal vein as the main drain for blood leaving your retina. CRVO occurs when this vein becomes blocked, typically due to a blood clot or compression. Several factors can increase the risk of a blockage, including high blood pressure, diabetes, glaucoma itself, high cholesterol, and other cardiovascular diseases. Essentially, anything that can damage blood vessels can contribute to CRVO. Now, let's delve into the pathophysiology. When the central retinal vein is blocked, blood backs up into the retina. This congestion causes swelling and bleeding within the retina, leading to macular edema, or swelling of the central part of the retina responsible for sharp vision. More importantly, the reduced blood flow to the retina triggers the release of a substance called vascular endothelial growth factor, or VEGF. VEGF promotes the growth of new, abnormal blood vessels, a process called neovascularization. These new vessels are fragile and leaky, and can grow in the iris and drainage angle of the eye, eventually blocking the outflow of fluid and causing neovascular glaucoma. In terms of epidemiology, central retinal vein occlusion is more common in older adults, typically over the age of 50. People with pre-existing conditions like hypertension, diabetes, and glaucoma are at a higher risk. While precise figures vary, studies suggest that the prevalence of CRVO is around 0.5% to 1.6% in the population. The development of neovascular glaucoma after CRVO occurs in a significant percentage of these patients, highlighting the importance of early detection and management. What are the signs and symptoms? The most common symptom of CRVO is sudden, painless, blurred vision in one eye. The severity of vision loss can vary depending on the extent of the blockage and the presence of complications like macular edema. Patients may also experience floaters, which are small dark spots or lines that appear to drift across their field of vision. The development of neovascular glaucoma can add symptoms like eye pain, redness, and further vision loss. Diagnosing central retinal vein occlusion involves a comprehensive eye examination. This typically includes measuring your visual acuity, checking your eye pressure, and examining the retina with an ophthalmoscope. Your doctor may also perform fluorescein angiography, where a dye is injected into your bloodstream and photographs are taken of your retinal blood vessels to identify areas of blockage and leakage. Optical coherence tomography, or OCT, provides detailed cross-sectional images of the retina to assess for macular edema. CRVO can be broadly classified into two main types: ischemic and non-ischemic. Ischemic CRVO involves more severe blockage and greater retinal damage, leading to a higher risk of neovascular complications like neovascular glaucoma. Non-ischemic CRVO is less severe and has a lower risk of these complications. Distinguishing between these two types is crucial for determining the appropriate treatment and monitoring strategy. Treatment for central retinal vein occlusion focuses on addressing the underlying cause, managing macular edema, and preventing or treating neovascular complications. Intravitreal injections of anti-VEGF medications are commonly used to reduce macular edema and inhibit the growth of abnormal blood vessels. Laser photocoagulation is another treatment option used to destroy areas of the retina that are producing VEGF, thereby reducing the risk of neovascularization and subsequent glaucoma. For neovascular glaucoma itself, treatments might include medications to lower eye pressure, laser procedures like cyclophotocoagulation to reduce fluid production in the eye, or even surgery such as a glaucoma drainage device implantation to improve fluid outflow. While there's no guaranteed way to prevent central retinal vein occlusion, managing risk factors can significantly reduce your chances of developing the condition. This includes controlling high blood pressure, diabetes, and high cholesterol through lifestyle changes like diet and exercise, and medications when necessary. Regular eye exams are also crucial for early detection and management of any potential problems. The prognosis for central retinal vein occlusion varies depending on the severity of the condition, the type of CRVO, and the presence of complications. Some patients may experience significant and permanent vision loss, while others may recover some or even most of their vision with appropriate treatment. Recent research is focusing on developing new anti-VEGF agents with longer duration of action, as well as exploring novel therapies to promote retinal vascular health and prevent the development of neovascular complications. This is an active area of research, and hopefully, future advancements will lead to even better outcomes for patients with CRVO.